Hello everybody, our topic today will be about the autonomic nervous system. As you remember, in the last video, I talked about the role of the autonomic nervous system in controlling the blood pressure as a major mechanism in regulating the blood pressure. Now, I'm going deep further to talk about the autonomic nervous system. What is autonomic nervous system? Autonomic nervous system is an involuntary part of nervous system that regulating the blood pressure, the gastrointestinal secretion, and the genitourinary system. And for this reason, it's very important to understand and to know very well about the different type of the autonomic nervous system. Autonomic nervous system basically is divided into two groups. Number one is the parasympathetic autonomic nervous system. Number two is the sympathetic autonomic nervous system. In the parasympathetic autonomic nervous system, actually, as you can see here in the lower left part of our screen, this woman is very calm, relaxing, and listening to the music, and she is obviously under the control of the parasympathetic. Unlike the man who is very frustrating, anxious, I don't know what is his problem exactly, but he looked very anxious, and obviously he's under control of the autonomic nervous system, the sympathetic part specifically. In autonomic nervous system, both the parasympathetic and sympathetic have relay ganglion or station-like, and this feature is unlike the somatic system, where there is a direct connection from the CNS into the skeletal muscle. As you can see here clearly in this figure, there is a direct pathway without any ganglion, unlike in the parasympathetic and the sympathetic, where there is ganglion that connected between the presynaptic and the postsynaptic connection to the target organ. Parasympathetic and sympathetic located in two different locations. There is an important anatomical difference between them. For example, the parasympathetic is located in the paravertebral region in the thoracolumbar part, while the parasympathetic in the craniosacral part, but most of the ganglion of the parasympathetic system is located mainly, or they located mainly on the organ where they innervated. Also, there are important receptors that we must know as they are part of the autonomic nervous system. We have the nicotinic receptors and muscarinic receptor. In nicotinic receptor, we have the nicotinic M receptor, where it's located in the neuromuscular junction, and we have the nicotinic N receptor, where it's located in the autonomic ganglia, the CNS, and adrenal medulla. Muscarinic receptor also have different subtypes from M1 to M5, and as we mentioned before, M2 is located mainly in the heart, and it's responsible for decreasing the heart rate and decreasing the contractility, and this is, we call it in the last video, a negative chronotrophy and dromotrophy effect. This picture demonstrates the anatomical location of the sympathetic, located here in the paravertebral region, the thoracolumbar part, while the parasympathetic located mainly in the craniosacral region, and other ganglion located in the organ where innervated by the parasympathetic outflow. The last part of the autonomic nervous system we will have today is a neurotransmitter. As you see here, the parasympathetic, we have the parasympathetic and the sympathetic innervation. And as I mentioned before, in autonomic nervous system, we have a relay ganglion that connected between the presynaptic connection and the postsynaptic connection. And you see here clearly this nerve that from the CNS to the ganglion called the presynapse, while the outflow or the connection from the ganglion to the target organ called the postsynapse. You must bear in your mind that all presynaptic ganglion, regardless if it is sympathetic or parasympathetic, it uses acetylcholine as a neurotransmitter. Okay, but the difference here in the postsynaptic mainly. For example, in parasympathetic, also acetylcholine used as a neurotransmitter in the postsynaptic connection. While in the sympathetic, we have different neurotransmitter. We have the norepinephrine, we have the acetylcholine, and we have the dopamine. And actually, the type of the neurotransmitter used, it depends mainly on the target organ. For example, if the target organ is expressing the beta or alpha adrenergic receptor, so the main neurotransmitter used will be the norepinephrine. While if the target organ is a sweat gland and vessel and it expresses the M2 receptor, the main neurotransmitter will be acetylcholine. While if the target organ is a renal vessel and it expresses the D1 receptor, so the main neurotransmitter that releases from the postsynaptic sympathetic autonomic nervous system will be the dopamine. But we have only one exception here, as you can see in the adrenal gland, where there is no postsynaptic connection from the adrenal gland to the target organ, and in this case the neurohormonal transmission play an important role, and epinephrine and norepinephrine can be released into the blood and directly act on the target organ. This is all about the autonomic nervous system. We talk about the definition, the different types of the autonomic nervous system, the anatomical location, the important receptor, and the neurotransmitter. Of course, if you have any further question and about the autonomic nervous system, about the physiology, or about the cholinergic, adrenergic pharmacology, please visit me on my website by clicking to this link. And of course, if you like the video that you watch, please like and subscribe. Thank you so much for your watching.